Well, hi everyone, good evening. Thanks so much for jumping on. So tonight's live, we will be discussing low response to ovarian stimulation. So Dr. Asti, could you please give us a brief introduction on that topic?
Excellent. So yes, so we covered ovarian down regulation regime and the ovarian stimulation protocol. Today we'll be discussing about ovarian response, specifically low ovarian response in IVF. So we need to first define the problem, what we mean by low ovarian response. So conventionally, if you get less than 5 eggs in IVF, that's considered low ovarian response. That's total number of eggs, immature and mature eggs. In total, if you get less than 5 or less, that's considered as a low response. So that's one definition, but that doesn't fully explain a low response, because you may have a good response to stimulation, but actual total number of eggs you get may be low. So this can happen if you have very poor maturation of eggs, or if you have a problem with egg collection. Let us say in egg collection, if one of your ovaries is not accessible to aspiration, if some of the follicles are very high, not accessible, despite having good response, you may have a low number of eggs. In order to address that issue, so I have created special classification system which distinguishes between good response and low egg number and or low response. So yes, we will be posting that classification system on the comments after the live stream. You can have a look. So generally, the low response means low number of eggs in IVF, which is so total egg number is less than 5.
Thank you, Dr. Asti. Could you please explain why a low response to ovarian stimulation is a problem?
Yes, so essentially eggs are most fundamental part of fertility in IVF. So that egg number, egg maturity, and egg quality is by far the biggest factor which determines the outcome of IVF, which means whether you get successful pregnancy or not. So yes, egg and sperm play important role in embryo creation, but egg plays much more important role than sperm. Generally, in 80% of responsibility lies on the eggs. So let us say if let us say 100 couples do IVF, if they have a poor outcome, for example, so in 80% of cases it's due to eggs, and 20% of cases due to sperm. But in individual couples, sperm may play more important role if sperm parameters are poor. But generally, when we generalize, egg plays very important role. That's why the more eggs you get, the higher the chance of creation of embryos, and the higher the chance of creation of high-grade embryos or multiple high-grade embryos. Success generally comes from high-grade blastocyst embryos. That's determined by how many eggs you get in total, how many mature eggs you get, and of course egg quality. So this is why if you have a low response, low number of eggs, then you are likely to create poor quality embryos or low number of blastocyst embryos. So this is the reason why low response is one of the biggest problems in IVF.
Thank you, Dr. Asti. How many numbers of eggs would you say is a good number in IVF?
Yes, so optimal number of total eggs is 10 to 15. When you get in total 10 to 15 eggs, that's optimal. Why it's optimal? Because there's the risk of ovarian hyperstimulation is low when you have a less than 15 eggs. So if you have a more than 10 eggs, that indicates very likely you will get few high-grade embryos. So here, this an optimal number of 10 to 15, you are likely to get good number of high-grade embryos, each giving you approximately 20 to 50% chance of implantation depending on your age and uterine condition, and you don't have a very high risk of ovarian hyperstimulation syndrome. That's why if ovarian reserve is good, we try to get 10 to 15 eggs in IVF cycle.
Great, thank you. And can you improve your egg number by increasing FSH dose?
So FSH dose plays important role in terms of improving the response, but cannot determine a response completely. For example, so essentially ovarian response determined by a number of factors. The main factor is a baseline egg reserve. So baseline AMH levels, baseline antral follicle count. So if egg reserve is low, let us say low AMH and low AFC, that indicates any given time you have a low number of eggs ready for stimulation. Let us say if you have AMH of 5, antral follicle of 8, probably any given time you have like 6 to 10 follicles ready for stimulation, but they will be in a very different size and very different stage of development. Larger anther follicles, which are 8, 9, 10 millimeter follicles, they have a sufficient amount of receptors. They can respond to stimulation quickly. But smaller follicles, let us say 5, 6, 7 millimeter follicles, these are medium-sized anther follicles, they need a little bit higher dose of stimulation to reach the threshold for activation. For them, for example, let us say you have a patient at the age of 40 with an anther follicle of 8, AMH of 5. So when you use 300 units of FSH, let us say Menopur, for example, or Gonalef, so then you can activate maybe 3 leading anther follicles. But if you use a higher dose of stimulation, let us say 450 units of FSH, you may be able to activate smaller follicles. Why? Because the threshold for activation for FSH is high. So which means you need to reach that threshold to get them into a growth stage. So you may get 6 eggs. If you do 450 or 300 units of FSH, you may get only 3 eggs, for example. But again, there's a limitation in terms of the dose, in terms of increasing the dose. So let us say if you don't have many follicles, doesn't matter how much of FSH you use, you can get more than available number of follicles ready for stimulation. Yes, for patients with a low egg reserve or with a low response to stimulation in previous cycles, we put them in a very high dose of stimulation, 450 in some patients, 600 units of FSH. Try and push ovaries as much as possible to get as many eggs as we can. Generally, it is safe to use a high dose of stimulation in this group of patients because the risk of ovarian hyperstimulation is very low, because number of follicles, number of eggs are going to get low, so risk is not high. And also, you cannot overcook eggs by giving higher dose of stimulation. Why? Because each egg, each follicle has got their own threshold for activation and saturation. So if you give more FSH, they simply do not register. They don't even recognize there's like 600 of units of FSH in the blood because they get as much as they need. So, but the high dose of FSH is necessary for smaller follicles. Yes, increasing the dose of FSH is one of the strategies we want to address when patients have a low response to stimulation.
Thank you, Dr. Asti. And if response to ovarian stimulation is consistently poor, what would you recommend?
Okay, so essentially, if you have a poor response to stimulation, if patient needs another round of IVF, you need to optimize stimulation protocol. So optimization means, like we discussed yesterday, in protocol means you optimize down regulation regime. So antagonist, flare, or long down regulation. So you may need to change down regulation regime. So second is you optimize FSH dose, like we said, maybe go higher dose or change FSH type. In some patients, you use certain type of FSH. Despite having good number of follicles, their follicles do not get activated properly. So then, which means you need to change to different FSH next time. So then you optimize the trigger type or trigger dose. And also you may need to decide to go longer with the stimulation. Let us say in most patients, once you get leading follicles from 40 to 20 millimeter to the stage, so you should get mature eggs. In some patients, you need to go a little bit extra longer to get more mature eggs. So depending on their response in previous cycle, you optimize ovarian stimulation protocol in order to get more eggs and more mature eggs and healthy embryos.
Thank you, Dr. Asti. That was my final question on the topic. Before I conclude this live, is there anything else you'd like to add?
Yeah, so essentially, yes, we will be covering so ovarian stimulation. So regime we covered protocol, low response, normal, and high response. So so it's very important to have a good understanding of ovarian response or ovarian stimulation overall protocols and ovarian response, because this is by far one of the biggest factors which determines outcome of IVF. So this is why we'll just stay focused on this, and then this week and next week we will probably complete discussion of ovarian stimulation protocols for IVF. Thanks for everyone for joining. Thanks, Gabby, for organizing.
No
Thank you.
worries. Thank you, Dr. Asti. We'll see
Thank
you
you.
guys tomorrow for our discussion on a normal response to ovarian stimulation. Thank you.
Thank you.
Bye.
Thanks. Thanks.